Hi, I'm Dr. Youssef, and in this video I'll be walking you through cataract surgery step by step while highlighting a couple of key parts of my technique that I do differently to make the procedure safer, more efficient, and more comfortable for the patients. Cataract surgery essentially restores the vision by removing the cloudy lens uh, and replacing it with an artificial lens. Okay, this step, we're just stabilizing the eye with this ring, and there's a self-sealing micro incision done on the cornea, in the clear part, so there's no blood vessels broken here. So that's why the blood thinners are not a problem with cataract surgery. This is freezing, so we inject some extra freezing inside. It stings a little bit at the beginning and then make you more comfortable during the surgery. So this is xylocaine preservative-free. Now we can inject some thick viscoelastic material that would protect the cornea from the front and from the back of the cornea during the procedure, so the cornea doesn't get dry and the nurse doesn't need to keep wetting the cornea and freeze her time to do something else. This is a second incision. It's a 0.9 millimeters in size, and it's to introduce the second instrument during the procedure. Now this is a very important step, which is the what you call capsule-related. So where we remove a circular part from the very thin capsule that holds the lens in place, and with that will give me access to the inside of the lens material, so that I'll remove the cortical and nuclear material from inside and keep the capsule, which will hold the future artificial lens in place. I measure my capsule opening so that it's always covering the intraocular lens optic, so that decreases the possibilities of having opacification after the surgery. This is an important step where we split the layers of the lens into multiple layers so we can remove them safely. It's called hydrodissection and hydrodelineation. So it splits the nucleus, so that we start by removing the nucleus using the phacoemulsification, which is an ultrasound probe. And the hydrodissection will help the J-cannula step later in the process. This is the ultrasound probe, so it irrigates fluid from the side, aspirates from the tip, and the tip vibrates. And the one on my left hand is what we call chopper, which will help me move material inside, and will use it to split the nucleus into multiple quadrants, and will remove the quadrant one by one. One important step that you will see later is the use of the J-cannula, which is one of the biggest differences in my approach and how I perform cortical cleanup. Many surgeons rely primarily on aspiration to remove the residual cortical material. I use the J-cannula technique, which is designed to follow the natural curves of the capsule and allows to do a thorough cortical cleanup using irrigation-based sweeping rather than aspiration, as the aspiration can capture the capsule and rupture the capsule. The goal is to reduce traction and result in a good, significantly clean capsule. And this is the J-cannula here. So it will irrigate the cortical material out of the eye to leave a clean capsule over which we will implant the new lens. You can see it's the material will just come out of the wound. We don't need to do any aspiration. The second different thing that I do is the dropless or the no drops protocol, which I use for both safety measure and convenience tool. It helps protect the eye at the end of the surgery, reducing the burden of long postoperative drop schedule, making it recovery easier, not only for the patient, but also for the families. The J-cannula step was done, and now we're injecting a different viscoelastic into the capsule to open it so that we can implant the new intraocular lens. It goes in folded, and it opens inside. It goes in like a taco. And it has a circular part, which is the optic, and two legs, which are called haptics. And it goes in, and we have to make sure that the lens is in good shape and complete, and it's completely inside the capsular bag. to help the recovery and avoid inflammation. So we position the lens into place within the bag. And now it's opening. And then we will use what we call irrigation aspiration, IA, to remove the fluid, the viscoelastic on any cortical material out of the eye. At the same time, I'm using the lens itself as a shield to protect the capsule while doing this step, and we remove any cortical material that's left. Now we're going to hydrate, going to inject some fluid inside the eye, make sure that the lens is in place, clean behind the capsule with irrigation, not aspiration, and just do a blind sweep in the anterior chamber of the eye, and then do some hydration using antibiotics. So this coming one is an antibiotic, which is part of the dropless surgery. So it will inject antibiotic into the wound so that this will hydrate the wound. You can see the white, which goes really quickly after, but the antibiotic will stay. And this will keep the eye from closed without even needing sutures, and will add this super amount of antibiotics to prevent infection. And this is the subconjunctival part, which will release over the coming few days so that you don't need to put the drops for 5 weeks. So that's how we do the surgery and how different it is.